Hello and welcome to COVID Conversations here on WNCU 90.7 FM. We're streaming on YouTube, Facebook, and Instagram. I'm your host, Kimberley Cartwright, and I'm the News and Public Affairs Director here at WNCU, and we're using the Zoom platform to talk about how COVID-19 is affecting our world. Channte Keith is my guest today. She is the Deputy Director for the Center for Black Health and Equity in North Carolina, and I was very surprised to hear that it was headquartered here in Durham, North Carolina. We're going to talk a bit today about the state of Black health during COVID, as well as the many things this organization does in support of health equity for African American people. Hello, Channte, and welcome today.
Thank you so much, Kim, for having me.
Yeah, it's my good pleasure to have you. And I was really excited to learn about the Center for Black Health and Equity. Let's start by getting a definition of what that is. What are you, and then what does the organization do?
Yeah, sure. Well, again, thank you for the invitation. Again, my name is Channte Keith, Deputy Director for the Center for Black Health and Equity. The center has actually been around for about 22 years. Our mission is to provide comprehensive public health programs that benefit people of African descent. And our organization was originally founded to address the disparate impact that tobacco use has on the African American community. So we're actually formally the National African American Tobacco Prevention Network, but we've been fortunate over the years to expand our scope. So we're doing work in issue areas such as cancer, HIV, food and nutrition, COVID-19, mental health, and women's health. So I currently serve as the Deputy Director for the organization, and I assist our fearless leader, Del Monte Jefferson, in operationalizing the strategic vision that's set by the board and the Executive Director. So our center, we envision a world where every person of African descent can obtain optimal health outcomes. We try to get to that vision by doing things like building community capacity, developing infrastructure, as well as promoting equity-centered policies. So our organization, we are community-centered. So for every funding opportunity we receive, we take at least a third of that funding and we give it back to community-based organizations and coalitions across the country. They are making noise, they're raising awareness, and they're pushing for policies that improve the health outcomes of our people.
So I want to talk now about the death rate. Who dies most from the most fatal diseases?
That's interesting because Black folks tend to be off the chart for most chronic and infectious diseases across the board. I did want to talk a little bit about our major event called the State of Black Health. The State of Black Health is one of our major conferences where we talk about the current health, economic, and social justice disparities that are impacting African Americans. So we talk about things such as how chronic diseases such as cancer, HIV, heart disease, hypertension, mental health, all of these issues and concerns disproportionately impact the African American community and causes us to be more likely to suffer from chronic disease, as well as our mortality rate tends to be higher than all of our counterparts. But with the State of Black Health, we also talk about things like wealth gaps, unemployment, pay disparities, employee discrimination, and how that ultimately impacts our health. We also talk about racism as a public health emergency and how stress, microaggression, mass incarceration, and how all those social ills impact our community's health, as well as contribute to our disease rates, as well as mortality rates.
So when does that forum happen on the State of Black Health?
Yeah, so the State of Black Health, the first one happened in 2018. We did it in Atlanta, Georgia, and it's really a place where we pull together community advocates, elected and appointed officials, federal, state, and local health officials, anyone who really cares about Black health. Into a space where a safe space, we call it, for folks to show up in their most authentic selves, for a discussion on what are the best policy solutions that will lead or make an impact to having our communities be healthier or live longer. So again, we did the first one in 2018 in Atlanta. We also did a community forum in 2019 in New Orleans. 2020, we tried to do it virtual. We tried to do it in person in Charlotte, but COVID, of course, had other plans. So we decided to do it virtually in 2021. But we're so excited because now we're going to Oakland, California, December the 1st. And so we're having our community regional forum in California, December the 1st on World AIDS Day. We're really excited about that. And then we're going to Puerto Rico in September of 2023 for our State of Black Health National Conference.
So your organization, of course, works to reduce rates of death and illness among African Americans. How are you messaging about COVID-19?
Yeah, so we talk about things like, again, wearing your mask, socially distancing yourself, making sure that you're getting vaccinated as well as boosted, but also making sure that you're not relying on social media alone to get your information, because we know that there are maybe some mis and disinformation that's being spread across social media platforms. So our campaign is called the Truth Check. The Truth Check campaign really talks about or stresses the importance that, not all sources of information are created equal. And it's important to analyze, evaluate, and share truthful content to avoid the spread of misinformation.
So how are you directing people to what you consider the truth about COVID? Is it to the CDC for information, or is there a clearinghouse for that?
Yeah, absolutely. First and foremost, it is the CDC. That's where we rely on our information. Again, the Truth Check campaign, you can go to truthcheck.org to get more information. But it certainly points you to several resources that we have deemed to be that provide factual information about COVID-19, the vaccine, as well as symptoms and how to best prevent the spread of COVID.
I want to know now, how has COVID-19 shifted the landscape of healthcare for African Americans?
It's interesting because for several things, in terms of delay in medical interventions that people really needed. That's one of the shifts. I personally know some folks that stopped cancer treatment and haven't gone back, or they've pushed back their mammograms or colonoscopy, pap smears, and dental care is a big one because of COVID-19. I've even had my primary care doctor personally request that I delay my annual physical so that I can avoid contracting COVID-19 or the flu. So in terms of the implication for that is because folks are delaying their treatment, that's going to exacerbate the health inequities that we're already experiencing as a community. So that's a big concern. The other concern is that I'm really excited that the CDC is about to invest $3 billion into the public health workforce, particularly because, as we know, COVID has shifted the landscape in several different sectors. So there's a gap in educators, there's a gap in medical providers, but there's also a huge gap in public health. So right now we're looking at, how do we recruit, attract, and retain a diverse public health workforce, which really has implications for our community, especially when we're talking about equity, because we want to make sure that these positions understand how to engage our community in a way that helps to better our health outcomes, which we know right now is certainly a challenge.
So you also work within HIV AIDS. So talk about what the organization does to help people with information about that disease.
Yeah, so our HIV work really started about 7 years ago. So we're currently funded through the CDC, Partnering and Communicating Together, PACT, which is our signature HIV program. Within that program, what we're charged to do is really put out messaging that helps folks to get tested, helps people living with HIV get into treatment, and combat stigma around HIV. So we do large scale events. We've done Essence Festival in the past. We just did a soul picnic that I think the reach was about maybe 4,000 folks, where we try to get as much messaging in front of folks, again, around those key areas. One being the Doing It campaign, which we talk a lot about, how to, the importance of getting tested, and the importance of engaging in healthy sexual behavior. But we also do a campaign called HIV Treatment Works, which really encourages people living with HIV to get into care and stay into care, as well as Stronger Together, which is our campaign around combating anti-stigma. So our HIV program we're really proud of. We have a program manager on board, Dante Pryor, who is all across the country doing events that really get the messaging, push the messaging out there. But one of the things that we're really excited about is that the center has been able to get into spaces that normally are hard to reach. So we do a lot of outreach to the ballroom community, which if you've ever seen the show Pose, that's what the ballroom community entails, which is, great competitions around voguing and dancing and walking and costuming. So we tend to try to include HIV messaging in either the props or the clothing that folks wear, just as a creative way to really ramp up or beef up HIV prevention messaging.
So what about your organization's work against the tobacco industry's marketing practices to Black people?
Yeah, so the Center for Black Health and Equity was actually founded to address the disparate impact of tobacco use. And what we understand is that tobacco use is still the #1 preventable cause of disease and death within the United States. And so, of course, much like other chronic diseases or other areas, it has a disproportionate impact on African Americans. So the center has been the forefront and the leader in combating the tobacco industry, because we know that the tobacco industry has a sinister way of targeting our community through advertising. And I'd like to tell folks that normally you may not see the tobacco industry on television and you may not see them on your radio, but they're there. They're giving money to our HBCUs. They're giving money to some of our civil rights leaders for the purpose of putting out misinformation. So one of the ways that we've done that is really through combat the tobacco industry is through policy change. We had our first policy win in 2013. In Chicago, where we worked with the mayor as well as the director of the Department of Public Health in Chicago, and some elected officials, 2 elected officials off of city council. And we got the 500-foot buffer zone ordinance passed, which restricted the sale of flavored tobacco products and included mentholated tobacco products within 500 feet of a public school, which is really important because we know that over 80% of African Americans smoke mentholated tobacco products. And so our stance is that we have to get, menthol off the streets, mentholated tobacco products off the streets if we're going to make a dent in tobacco-related disparities. And so Chicago was the first city to pass the 500-foot buffer zone ordinance. And we did that through community engagement, hosting town halls, really getting into the community to talk about the dangers of tobacco use, and particularly how the tobacco industry targets our community and the impact that mentholated tobacco products has on our community. And so since then, Chicago was the first city. Now we're over about 200 cities across the country that have done something around banning the sale of flavored tobacco products and including mentholated tobacco products. So we're really excited because that then in turn got the attention of the FDA, who plans on banning mentholated tobacco products, hopefully in the near future.
So very quickly, what's the biggest takeaway you want people to leave with after this interview? We only have like a couple of minutes left.
Yeah, well, again, thank you for the opportunity to be here. I would say one of the biggest things for the center is that everything needs to be, rooted in equity. We believe that, everyone in our community has the potential to attain his or her full health potential, but there are some things that, we need to address, like racism as a public health emergency. We always talk about the social determinants of health and how our income and education and job security, food security, housing, transportation, all of those things matter when it comes to really being able to live out our best lives. On a personal note, I always tell folks, be an advocate for yourself. It's always important to advocate for your health. And then, once you're your best, healthiest self, then you can advocate for our community as well.
Channte Keith is my guest today, Deputy Director for the Center for Black Health and Equity, North Carolina. Thank you so much for coming in to be a part of the show today.
Thank you, Kim. Thank you so much.
You're certainly welcome. And we want to thank you, audience, for watching via YouTube, on Facebook. And we want to thank you for listening also on WNCU. We want you to like us. We want you to follow us. And we want you to subscribe to our pages to see more of our archived shows. I'm Kimberley Pierce Cartwright, and I'm your host for COVID Conversations. Thank you so much, so very much for tuning in.